Post kidney biopsy, generally kidney biopsy is a safe procedure, but there are some complications which can happen. The most common complication is the pain after the kidney biopsy. So once the effect of the local anesthetic goes off, there can be a pain where we did the biopsy, and this pain generally resolves in 1 or 2 days and it responds to the painkiller. And the second important complication is the bleeding. The patient can have bleeding in the urine, or there can be bleeding around the kidneys. So if the patient has bleeding in the urine, this bleeding can be severe and it can lead to clotting of that blood in the urinary bladder. So sometimes the patient can require an insertion of a Foley's catheter, and they may require rarely evacuation of that clot, or they may require a treatment which will lead to dissolution of that clot into the urinary bladder. Sometimes, very rarely, patient can have severe life-threatening bleeding which may require blood transfusion or a procedure or a surgery to stop that bleeding. And there is another complication called arteriovenous fistula. Generally, the blood vessel, the blood from the heart is supplied to the kidney by arteries, and the blood is taken back to the heart by veins. Both of them are side by side in the kidney, and if we, with this needle, if we do a biopsy, this artery which is taking the blood to the kidneys will be joined with the vein which is taking the blood back. So without reaching the kidney, the blood will bypass here by the track which is made by the needle, and that is called an arteriovenous fistula. So this generally is benign, which will not cause much complication, it will close by itself, but sometimes it may lead to hypertension or persistent bleeding, or it may lead to heart failure, during which, or the patient has that complications, then we will intervene.